Hello, thanks for stopping in to view this. I'm hoping that it will be informative and eye-opening and thought-provoking. Today, we'll talk about the high deductible Medigap plan. Okay, my goal would be to get people to think outside the box and look at how there is an option here versus, those standard plans that so many people talk about, plan F, plan G, those kind of things. Let's look at an alternative where potentially you could save thousands of dollars, and even, more so, right, if you got spouses in the house or two people in the house utilizing plans. And we'll look at why agents don't talk about this plan enough. So let's dive into it right here. Okay, Plan G High Deductible is what we're talking about. If you go look at a Medigap chart, which you can find, anywhere online, easily Google it, you'll see that Plan G High Deductible is in the exact same column as traditional Plan G. So that begs the question, well, why and what's the difference? So Plan G High Deductible, as the name implies, it does have a higher deductible, and you can see in 2022 we're at $2,490 as the deductible max for the year. So you would pay your out-of-pocket cost share during the year until you reach the deductible. So this would be that quote unquote, the 20% that, Medicare A and B covers roughly 80%, so you're responsible for the 20% there. So when and if you reach the deductible max, the plan would cover 100% the rest of the year. And again, it's all the same benefits as traditional Plan G Medigap. So it's really very straightforward. It's just, a higher premium plan, but it's got all the same benefits. So let's look at premium savings here versus, the out-of-pocket exposure that you would have, right? So the example here we're going to use for a female who would be age 65 in the month of September. So her Medicare starting September 1st, 2022, in a 48114 zip code that's here in Southeast Michigan. So we can see plan there listed on the left. We got our traditional G and our high deductible G. You can see your premium there, and then you can see the deductible. So that deductible on the right side, the traditional plan G, that is for the Part B deductible for this calendar year, and that's embedded into the plan G high deductible. Anyway, so there's no difference there. All right, so we see the premium difference then for the first 12 months of the policy is $920.04, right? So a pretty substantial difference as far as premium on that. And then if we look at the average annual rate increase in the area is about 5% year over year, and the high deductible G has a much lower average annual rate increase at 2.5%. So the question then will be, well, what does that kind of look like over time? Let's take a look. The extended forecast here for 6 years, we can see Plan G, your traditional, and then your high deductible. So we've taken into account that average annual rate increase there. And as we go along, right, over 6 years, we can see traditional G and high deductible G. There is a significant difference in premium. Almost $6,500 over a 6-year period for one person, right? We would double that if we had spouses on the plans or two people in a household. So you can see here there's a tremendous amount of leverage over time against what that deductible is. And if you think about it, right, if you're doing all the things that you should be doing to help maintain your health and all that, right, there is mathematically a lot working in your favor here to save money, over time. So as we look at the next slide here, why use Plan G high deductible, right? So it's a great option here. Okay, I want people to understand this is a tremendous value plan that is available for people. Okay, so you want to have all the benefits of the standard Plan G supplement, but you want to have lower premiums. Okay, It's a great option for people that are comfortable with having a higher deductible in exchange for those lower monthly premiums. And someone who is a saver keeps money in savings to cover the deductible each year, right? So you want to make sure that if I've got some tests, if I have to go to the hospital, if I need some procedures, whatever it is, I'm going to keep money in the bank. So the idea is that I'm going to take the premium difference, what I would have paid, and I'm going to keep it in the bank for future expenses should I need it. And it also avoids potentially much higher annual premium increases that are there. Again, that chart on the previous page, right, if you went back, that just assumes everything is average as far as, premium adjustments over time. So question then becomes, why don't agents tell people about this option? Okay. And as an insurance advisor, someone who's been doing this for a while, right, I don't have a problem telling you. Okay, there's two primary reasons. Number one, the saying easy to tell is easy to sell. Traditional Plan G, very quick and easy to discuss. Okay, it's, pay your premium, you get 100% coverage from day one, except, the $200-ish deductible on Plan G right now, right, and off you go. Just pay your premium, never get a bill. And second, agents are paid commission as a percentage of annual policy premium. Quite simply, traditional Plan G pays more to the agent. It's more lucrative for the agent to just roll with that. And don't get me wrong, traditional Plan G is very good coverage. It's extremely comprehensive. It is, you can think of it as in that premium for traditional Plan G, you're kind of prepaying against what would be, future expenses and stuff. So there's nothing wrong with that. Don't get, don't kind of, look at it as me putting down Plan G or saying it's bad to go about that route. I'm certainly not, because I have a lot of people, a lot of clients who utilize traditional Plan G. I just want people to understand that when we do the math here, there's a lot of reasons to look at the higher deductible plan and roll with it for the right type of people. So, just kind of revisiting real quick, traditional Plan G versus high deductible Plan G. I just want people to be aware that high deductible Plan G is a great option. There's potentially a significant amount of money that could be saved over time, particularly for someone aging into Medicare and, they're healthy, to take care of themselves. But also if you're someone that is older, let's say you're, 75, 76, 80, whatever it might be, your premium on, your plan has gone way up over time. You could dial that back quite a bit if you're a pretty healthy person, so it's worth taking a look at. So all our contact information here, feel free to reach out. Happy to, run quotes, talk to you. Sometimes just a simple 10-minute phone call can have a big impact for someone. So thanks for viewing, and we'll see you on the next video.